Okay, my name's Nick. I'll be your nurse practitioner today. I'm going to be doing a physical exam. Can you tell me your name?
Terry.
Nice to meet you. I'm going to wash my hands. First, I'm going to start with just inspecting your head for symmetry. No tics, no irregular movements, no lesions, no masses, no discolorations. Can you turn your head left to right, looking at your ears bilaterally, your eyebrows, your nose, your lips for symmetry? Everything is intact. I'm going to go ahead and inspect your scalp and then palpate for any tenderness or masses. I don't see any lesions or feel any lesions or any masses. Do you feel any tenderness? Awesome. Okay. And then look directly at me. I'm going to go ahead and assess cranial nerve 7 for the facial nerve for symmetry. Go ahead and smile for me. Frown. Puff your cheeks out. Raise your eyebrows. Good deal. So I would say that cranial nerve 7 facial nerve is intact as evidenced by symmetrical motor movements of the face. And I'm going to start with, I'm going to touch this cotton ball on your face, okay, real soft. Go ahead and tell me where you feel it. Close your eyes. Where do you feel it?
Right. Cheek. Cheek. Chin. Chin.
Fantastic. So that is cranial nerve 5 trigeminal is intact as evidenced by full sensation of the face. I'm going to check your continuation of the cranial nerve 5 trigeminal of the motor aspect. Go ahead and clench, bilateral movement, and then go ahead and open and close. No clicking, no crepitus of the TMJ, and cranial nerve 5 trigeminal is intact as well. Okay, next we're going to thyroid. Let's go ahead and look at your. Go ahead and look up at me. I don't see any obvious goiter. I'm going to come from the posterior aspect. I'm going to act like I'm choking you. I'm just going to find your cricoid process. Drop down bilaterally. No nodules, no masses, no tenderness, right? Can you swallow for me? Good deal. Okay, normal regular exam for the thyroid. No masses, no goiter. Okay, now I'm going to do the lymph nodes. Go ahead and look up at me. Let me know if you have any tenderness throughout this. Submental lymph nodes, submandibular, tonsillar, preauricular, postauricular, and occipital bilateral. Any tenderness? Go ahead, raise your shoulders up. Supraclavicular, and then infraclavicular. No lymphadenopathy present, no tenderness. I'm going to go ahead and lift this arm up and inspect for axillary lymph nodes, no lymphadenopathy, and then epitrocular. No tenderness?
Nope.
No masses, no lymphadenopathy. On the left side, I'm going to do the same thing as well with pads my fingers and looking for axillary lymphadenopathy. I do not feel any. And then epitrocular, the left arm. Any tenderness?
Nope.
Nope. So no lymphadenopathy. Lymph node exam is regular. Yes. So then we will move to the eye exam. I'm going to go ahead and first just look at your eyes. Look directly at me. I'm going to check your pupils. Okay, and look at your other pupil by looking at with the light on the left. That is direct pupil and consensual pupil constriction and dilation. Look at the left and look at the right. All right, same thing. So pupils are equal, round, and reactive to light. I want you to look behind me, okay? And I want you to look at this and follow it as much as you can. Good deal. So they converge medially. So there, we can say as a regular on the eye exam. The first part of the eye exam, his eyes converge and his pupils constrict when they converge and dilate when they look away. Okay, next I'm going to do the cranial nerve 2, the optic nerve, about doing the Snellen chart. I want you to act like you're reading a book. And you're wearing lenses or glasses? No?
Yes.
Lenses. Okay. Tell me the bottom line that you can see, the most bottom line.
All right. It is 4, 2, 6, 7, 3, 9.
Okay. So we can say optic nerve 2 optic, cranial nerve 2 optic nerve is intact by a 20/30 vision with corrective lenses in. Okay, next we're going to do confrontation. I want you to cover your left eye with your, and I'm going to cover my right. Tell me whenever you see my fingers wiggle.
Now.
Okay, good. Oh, cover your other eye. Yeah. Sorry. Tell me when.
Now.
Great. So we'd say that cranial nerve 2 optic nerve is intact in the peripheral fields. I want you to follow my fingers. You just follow them everywhere they go. We're checking cranial nerve 3, oculomotor, and cranial nerve 4, trochlear, and cranial nerve, keep following them, and cranial nerve 6, abducens, which are all intact as evidenced by bilateral symmetrical movement of the extraocular eye muscles. Okay? And as I was doing this exam, I also have been inspecting his eyebrows, eyelashes, cornea, irises, and sclera for any abnormalities, lesions, masses, discoloration, discharge, which are all negative. Okay, next we'll go to the ear exam. We're going to start with this side. So the right ear, I'm first inspecting for any redness, discharge, obvious foreign object, which is negative. I'm going to palpate the pinna, tragus, and malleus process for any tenderness. So let me know if you feel any pain. Tragus, pinna, tragus, and mastoid process. Okay? Next, I'm going to look inside the ear into the EAC. You're going to feel me touch and then feel this in your ear. Okay, I'm going to pull your pinna up and back. And I'm looking, there's no foreign object. Erythema. His TM is pearly gray with no bulging or perforations. And his cone of light is in the 5 o'clock. And also the incus and malleus are, his bony landmarks are identified through the otoscope. Next, look at the other ear. Left ear, I'm going to look, see there's no drainage, redness, swelling, no obvious foreign object. I'm going to also, again, palpate the pinna, tragus, and mastoid process. Let me know if there's anything painful.
No.
No? Okay, good. I'm going to stick this in. You're going to feel me touch, and then I'm going to put this in. I'm going to pull the pinna up and back. No foreign object, no erythema, no discharge, no lesions. TM is pearly gray, no perforation, no bulging, and the incus and malleus bony landmarks of the ear are identified. The EAC is clear of debris as well on the other side. Now we're going to do the hearing test. I want to hit this. I'm going to put it on your forehead. You're going to tell me if you hear it better in each ear or just both ears equally. Okay?
Equally.
Fantastic. So that's the Weber test examining the cranial nerve 8 acoustic, which is intact as evidenced by bilateral hearing in the ears. So the Weber test. Okay. Okay. So next we'll do the nose. I'm going to use the otoscope just to look. Go ahead and look at me. I'm looking and inspecting the external nose for any lesions, masses, or discharge. No redness, none of that. All negative. Can you close one ear or one nose? Nair. Can you breathe? Fantastic. Do the other nair. Close it off. Okay. No obstruction.
No.
Fantastic. I'm going to look inside. No masses, no lesions, no redness, no drainage, and no septal deviation. Okay. I want you to close one nair. I want you to tell me what you smell and close your eyes. Yeah.
Lavender.
Fantastic. Keep your eyes closed. What do you smell?
Lavender.
Fantastic. Cranial nerve 1 olfactory is intact as evidenced by sense of smell. And this, real quick, I'm going to palpate your sinuses. Let me know if there's any tenderness, okay?
No.
Frontal?
No.
Maxillary? Fantastic. So it's a negative or a good nasal exam. Next, we're going to do the mouth. Inspecting the lips. They're pink, moist, and intact. No discharge, no lesions. I want you to open your mouth. I'm going to take a look. Submucosa, gingiva, pink, moist, intact, no lesions, no masses. Soft palate is intact. Posterior pharynx is pink, moist, and intact, no masses. Uvula is midline. Say ah.
Ah.
Okay. Stick your tongue out. Wiggle back and forth, up and down, curl. Fantastic. And then I want you to swallow for me. Good deal. So, cranial nerve. We're assessing a cranial nerve 9, glossopharyngeal, and cranial nerve 10, vagus, with the ah and the swallowing together. And then also cranial nerve 12, hypoglossal. with tongue movements. There was no fasciculation, no ticking. His and then just from the examination, his uvula was midline and soft palate rose and fell. There was no exudate on tonsils, no masses. His tonsils, he does have tonsils, and they were not swollen on examination. Okay, next we'll do respiratory. I would have the patient take the shirt off. We would first look at the anterior aspect, and there would be look for masses, lesions. I would assess his respiratory rate, depth, rhythm. Everything is normal. He's not using any accessory muscles to breathe, and he no discolorations. And then I would go ahead and assess tactile firmitus along with crepitus when I do touch his chest. Go ahead and say 99.
99. 99. 99.
Wait, what did that say?
99.
Okay, great. And then I'm gonna do posterior. Let's do it another way. All right.
99. 99. 99. 99.
Fantastic. No crepitus. Normal exam on the tactile firmitus. Vibrations were felt bilaterally. And yeah, while we're back here, I'm gonna go ahead and do percussion. Okay, and I should, in all fields, feel or hear resonance laterally. Wait, there we go. And laterally. Fantastic. All right, I'm gonna do anterior percuss. Resonance is still heard throughout. Fantastic. Okay. Last thing I'm gonna do. Oh, and when I first got his shirt off, I'd make sure that his anterior posterior diameter was half the diameter of the lateral. So AP half lateral, and that would mean a normal exam, no suspicion of barrel chest. Okay. Just take a deep breath in and out. Wait a second. Okay. Okay. Fantastic. And the last thing, I'm gonna go ahead and just touch you back here. I want you to take a deep breath in, deep breath out. Good. Exam is normal. He has symmetrical rise and fall of his chest. I think that is the end of our exam.